Alexa told me to stay inside. The Department of Health told me to take a virtual day. I mean, not everyone, of course, is so fortunate to do stuff like that.
Hello, welcome to Scrubs Unzipped. I'm your host, Annmarie, and today I have a very special guest. Her name is Linda Nozart, and she is a respiratory therapist. She's also worked as an administrative director for the asthma program in New York City, and she oversaw the New York City Department of Health Asthma Center, and she has like a long list of accolades. So I'm going to let her introduce herself.
Gosh. Well, thank you so much, Annmarie, for having me. And I'm just so grateful to be here with you. Always excited to do this type of stuff. So, hi, everyone. I'm Linda Nozart. I'm known on the social media platforms as the Asthma Lady. So, I do things around asthma awareness, asthma education. My main mission is to fight asthma disparities. So, and all things around that is what I do. That's pretty much it.
That's more than enough. That's what I would say. You're doing over and above. Like you're helping your community,
Oh,
and
thank you.
you're also an avid respiratory advocate for respiratory
Right,
therapists.
right.
And tell me, like, where did you start? How did your career start in respiratory?
Okay, great. I definitely started like how many of us start to like meaning I had no idea what the profession was when I first started. I started as a pharmacy student. So yeah, I started working at my in my neighborhood's mom and pop pharmacy store for like 8 years. I was there, so I pretty much was like a pharmacy tech. And so I was like, okay, I'm going to school for pharmacy. It makes sense to me. I got accepted and I hated it because I suck at math. It's like I'm bad
Oh,
at math. And also, I didn't like chemistry. So it was a struggle. Yeah, I wasn't doing good. So I just had to pivot, and then I took sociology for a little bit. Then I was like, I don't know what this is. What am I going to do with this? And then I saw a poster on the board in the health science building, and it says, "Do you have asthma?" And I was like, I do have asthma. I was like, do you like to help people? I was like, I do like to help people. And then it was like, okay, do you know what respiratory therapist is? And I was like, I don't. And then that poster was like assigned to me, and I was like, I want to sign up. And so that's how respiratory started for me. And I started at a level one trauma center back in 2008, night shift. So I got to see a lot of interesting things very early into the profession. And yeah, in 2010, I was covering PEDS ER. So this is how I got into the asthma stuff because that night in 2010, I met a patient. He was a 5-year-old boy who went into cardiac arrest 3 times because of a severe
wow.
asthma attack. And so by the time he got to me, he was already intubated. I had to put him on the vent, and he was in very bad shape, like real bad.
Mm.
And his mom was screaming, give him his prednisone, give him his prednisone. So she knew the ER routine. It's like they know what to do once they get there. The grandmother was very quiet. She was also there. And when she watched me put the vent um, on her grandson, I felt her heart break in half. So
Mm.
I so the story was she was in the kitchen cooking and he was in the living room playing,
Oh.
and she didn't know he was having a full-blown asthma attack. So by the time she realized what was going on, he was completely blue and the pump wasn't working,
Oh
of
no.
course, by that time. And so I had a very bad feeling that he was not going to make it. And he
Mm.
didn't. He passed away on the
Oh.
shift, and it was the first shift. I cried after work, and my husband, he said, "Well,
Mm.
Linda, why? What about this situation is different from the other ones, because you've seen children die before?" And I said, "Yeah." I said, "But strangely, I'm not crying for the boy. I'm crying for the grandmother, because she has to
Mm.
live with the fact that
Mm.
he died in her care." And that broke my heart. And I said, "You know what? I never want that to happen to another family ever again." So
Mm.
that night in 2010 changed my whole entire career. And I went back to school to get my master's in public health. I started volunteering as an asthma educator. I got certified as an asthma educator specialist. Um, so yeah, so it in and I took the role as the director of North Brooklyn uh, um, asthma program in 2014. I'm sorry,
Wow.
I'm like, what year are we in now? Ah,
10 years ago.
yeah. So I took that role and just have been involved in a lot of asthma initiatives, especially in New York City, because we have a lot of hot spots, a lot of hot
Oh
spots.
yeah.
Yeah. So, and North Brooklyn is one of the hot spots. Yeah, for high asthma prevalence uh in the minority communities. So yeah.
Hmm. So is it because they don't have access to care, or is it like cost, or
Uh,
what?
it's so many things rolled up. It's the basically the social determinants of health is a big part of it. Just that being things that affect our quality of life. So things like the foods that you eat, where you live, how you make your money, having access to green space, transportation, all those things. So if you think about it, if the neighborhood is not thriving in those capacity, then most of the time we can predict your asthma outcome just based on
Mm.
the zip code, pretty much, or the building that you
Wow.
live in. And yeah, it's crazy. And so um before, usually I see the numbers, the statistics, like, you could see it, but to see it in real time, like what's coming in your emergency room, who are in the inpatient units, and I we've done home environmental assessments. So what that means is we in the patient home. You know what I'm saying? So we follow you from the ER, or from the inpatient unit, and we go to your home to help you investigate what the problem is. And so it's sad to say that once I see the zip code, I have an idea already what's going on. You know what I'm saying? So, and the same thing with the address, the building, public housing. It's a lot. It's a
That's
lot.
a lot.
Yeah.
Wow.
Mm-hmm.
And you're doing your best to spread awareness. And as I said earlier, like, I give it up to you for going above and beyond for
Thank you.
um, for children and caregivers so that they can know. Because I have family members that have asthma. So can you give like um, what are what are triggers and some examples of triggers that might trigger asthma?
Right. Okay. So triggers are anything that make your asthma worse, flare up, activate, anything like that, because um your triggers, everyone's triggers are different. And so and we're surrounded by them. All right. So it's not a one size fits all. So anything that can make you have an asthma episode is considered a trigger. So that can be something in the environment. It can be an emotion. For me, is laughing. I love to
Yeah,
laugh.
that's a big
Okay.
one.
If I have a belly laugh in real time while I'm recording this podcast, I will start wheezing. You understand what I'm saying? So it's that is a trigger. It could be things like uh perfume, scented candles. So just different things. It could be smoke, uh, cleaning supplies. So it's a lot of different examples of what a trigger. Things like even being sick. I've been whenever I get sick with a cold, the flu. I get my flu shot every year because that is also another trigger for me. So what I like to tell folks is um you have to do the detective work with what your trigger are as someone with asthma. So if you have children with asthma or the person themselves, just be a part of that investigation. So I call it like Scooby Doo and them, Scooby Doo and the crew. So you're just kind of like playing together with the working together with the healthcare providers, the team, and finding out what the trick, because that's one of the important thing of asthma management is being able to remediate, get rid of the trigger or avoid it.
Yeah. So when I learned in school, I learned about all the triggers, pollen, and
Sure.
opening the
You
doors,
understand?
grass. So
Right.
like, do is the expectation that you like live in a bubble and everything is sterile?
No, I just, and I say that often too, because you see stuff like that, you can't control that. Like I can't control how much pollen is out there today. I can't
Mhm.
control if there's a wildfire. I never even experienced we experienced wildfire like not too long ago, and it was like that was
Mhm.
weird. So for us, we didn't know how to deal with that until we got the news on how to deal with that. Um but what you want to do is just find ways to kind of give yourself the heads up when stuff like that is happening. So there are apps, there are you could go to your New York City. I'm about to say New York City. I think everybody live in New York. You could go to your Department of Health. They usually have the stats on the pollen count for that time, for that day. So just like how you check with, you can even ask Alexa, hey Alexa, what's the pollen count today in Detroit or in New York, and whatever, and she'll tell you. But yeah, you can look that stuff up. You can look up air quality today. So all of that is available right now. So just like how you check the weather, you can literally check that stuff up and it will let you know what, I'm gonna stay indoors today. Today gonna be a virtual day.
That's like a good excuse for introverts. Like,
I
I'm
mean,
staying inside.
you
I got
know,
asthma.
Alexa told me to stay inside. Just like the Department of Health told me to take a virtual day. I mean, not everyone, of course, is so fortunate to do stuff like that. But just finding ways to just make to navigate through those things, like going out on certain days, like if it gets really hot at like 3 o'clock in the afternoon. If that's your trigger, just avoid going outside at that specific time. Just picking different times of when to jog in the park, if the pollen is high during the morning or something. Maybe don't go for the jog at that time. So just doing some alternative things here and there. So that's it.
It's like when you check the weather, you say, "Oh, it might rain today. I'm gonna bring my umbrella." So
Right.
you have like a little layer of
Exactly.
protection.
Exactly. Exactly. So yeah, having the heads
Yeah.
up, and then once you have the heads up, it's like, okay, well, how do I move? How do I maneuver for that day? So it's a day by day, um, case by case situation with asthma and triggers.
Okay. And I know that you are also a public speaker. So can you tell me how you use your platform and how you started in public speaking about asthma
Oh my
education?
gosh. Public speaking. I hated public speaking. I know I shouldn't say any of that stuff out loud, but I do. I did hate public speaking. So when anybody asked me to do it, I was like, no. um, but in 2018, I was like, you know what, Linda, you have to step outside your comfort zone, and it was an area where I wanted to grow, and I think I just needed something that I was passionate enough about to to get me to say yes. So, and it really was like the story that I just told you about the little boy. I really, in my mind, I've always envisioned a world where everyone has access to quality asthma education and asthma management resources. Just everyone. It doesn't matter, what how much money you make, where you live, anything. You just had access to the stuff, and then you can make the decision about what works for you or not. And so to me, to be that, I wanted to be that person to inspire people and to spread that asthma's with you forever, but it can be controlled. Once it's controlled, you can do your heart's desire. That's that's all I want to spread
Yeah.
awareness on. And I said, okay, I have to learn to speak in public. And the way I started was I did it afraid. That's what it
Mm.
was. I was scared. And even when I was afraid, I said, the mission is stronger than me. So just get through it. My first one, I was shaking so hard. I had the laser pointer off the presentation and it started to go in someone's face
This is you're
because I
like
was like this. And I was like, Linda, calm down. and then and then as I got in, I started to see that people they were starting to see that I cared what I was speaking about, and then that they wanted to receive the information, and that really helped calm me down. And I was like, all right, let me deliver, let me land the plane. And progressively I got better. So I would keep, so after that one time in 2018, I kept signing myself up for it, even though I hated doing it. I hated public speaking, but I kept
mm,
signing myself for. I kept making myself uncomfortable until I got comfortable being uncomfortable. So that helped me a lot. So I public speak even when I'm uncomfortable and afraid. I still do it. If it's for a good cause, then yeah. hmm So that's
wow. That's
yeah.
what you I hear what you said. You have to be uncomfortable to be
Be
you said you
comfortable
have to be comfortable
being
being
uncomfortable.
uncomfortable.
Yes, I have trained myself how to do that. And
How did
so
you train yourself how to
I
do
just keep doing the uncomfortable thing. And then once I do it and I realize that I did not die, I was like, I'll be like, oh, that wasn't that bad. Like, I'm still alive. Nothing really negative happened to me really, and it gives me the confidence to do it again. So that's the
that?
So it's like lifting weights. It's like when you see the first set of weights, you be like, oh man, there's no way I could do that.
Yeah.
And then so you just, you start building little by little. So you start with the small weights. And then you be like, oh, all right, let me add 5 more pounds. And then you start seeing yourself lift the heavier weights. And then you're like, oh, okay, now I could do 100 pounds. So you build your confidence level um during that time of being comfortable while being uncomfortable, if I'm making sense. It's like a,
Yeah.
yeah, it's something you
It's
consistently
like
build.
you have to, like when you're riding a bike, first learning how to ride a bike, you
Right, you get.
learn with like the training wheels, and then
Mm-hmm.
like little by little you take the training wheels off and then you're riding the bike. That's how
Exactly.
I picture it.
Exactly. So yeah, so I just continue to sign up for it. And once again, it if it's aligned with my mission, the vision, and spreading awareness, it's a green light.
So what is your mission? What is your vision?
So yeah, so basically what I said was just the vision that everyone, like, asthma disparities is annoying to watch. So pretty much
Hmm.
with everything that we have, meaning all the medical advancements that are out there, the treatment plans, there's still a huge gap between who lives, who dies, who goes to the emergency room over and over again for the same thing, and whose
Hmm.
quality of life is affected. Um, it's annoying to see.
Hmm.
So my vision is that this gap goes away and that everyone has access to resources that can control their asthma, and everyone
Hmm.
can live their best life, just improve quality of life, asthma control. So I this is the mission. um I don't think it's like I said, it's annoying to see that um minority communities carry a bulk of the asthma burden in this country.
Hmm.
And so my mission is to change the narrative around asthma disparities, and in Black health in general. I would just like to push us in a direction where it's positive and people are just making the best decisions for them. Yeah. So that's the mission.
That is a great mission. And I was just thinking, I interned at a pediatric doctor's office.
Hmm.
And what I was noticing is when I would call the parents or caregivers to come back for their child or their checkup, like
Hmm.
they wouldn't come back, and that's a lot. That's a big part in asthma, like controlling
Hmm.
asthma, like coming back for the 3 months
Yes.
visit. So can you explain, or can you like give like your opinion on what are some of the hindrances caregivers have when they're
Yes.
trying to keep the asthma in control in
So
kids?
once again, it's so many. It's so we and I'm like you, I'm a clinician, so I'm a respiratory therapist. We in the hospital world, so I hear it a lot. I'm in ER, inpatient unit, in the asthma clinic. So the team, or let's say the provider, right, the doctor, who might be handling the case, will be like, oh well, this is a patient or a family that's not adhering to the treatment plan. They don't go to they don't have their a primary care provider. They don't go to the follow-up visit. So just like you said, won't show up. And someone like a me, right? So I was a asthma case manager. So let's say if I get that case, we would follow up to find like a a root cause analysis. Like, okay, let's do the once again that detective work. Let's find out why. And what we often find is that this is an onion layer. I call it the onion layer of
Mhm.
social determinant health issues. So just once again,
Wow.
those issues that affect our quality of life. And I often say sometimes we peel back those onion layers, and you just want to cry because you feel like when you hear what's going on with folks, it's like, dang, I can only imagine, what it is to be like that. And the role of just trying to help peel back the onion layer as much as possible and removing as many barriers as possible to get that person to the follow-up visit, to get them to that prescription that they need, uh, um, and linking them to any resources that they need, and whether it's a social worker or just being linked to other community-based organizations that can help out. So just being able to remove barriers, and an example can be like, okay, say the person can't get to their visit. um we've seen situations where it's a single mom with two jobs, and it could be something just as simple as not being able to fit in that appointment because of the two jobs and having three kids. So it's you understand what I'm saying? So it might be a childcare issue. It might be not having paid time off, no PTO or anything like that. And so we would try to find like an organization that can help out with like childcare, or maybe it could be something where we've seen cases where we're dealing with domestic violence case. Um, the follow-up visit is not the priority, unfortunately, when you don't feel safe at home, right? So yeah, you just never know what someone is dealing with behind closed doors. And so if you build a rapport with them and they trust you enough and to say, hey, listen, I need help, then we can start to help. Yeah.
Yeah, I think the important thing is what you said is asking for help. Like that's like the number one step because people will suffer in silence.
Correct.
And then you have a case where a child comes to the emergency room and their asthma's not been controlled, but it's been like a month occurrence. Sometimes it doesn't happen all in like one snap. Sometimes it's like a gradual, and then there's that one trigger that can just tear everything down. So I think that's most important is saying like this doesn't seem important, but like the seasons are changing, so
Hmm.
you want to make sure you get your appointment in when it's not an emergency instead of
Right,
waiting
right.
until the last minute when it becomes an emergency.
Of course, yes, 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 totally. And we know there's so, you, Annmarie, life be lifing,
Be
but
life in.
yeah, like we get it,
Life
we
be life
totally
in.
get it.
Yeah.
But these things are one. It's one of those things where it's not important until it is, until something happens, unfortunately, and then it's like, dang, I should have, And we just want to be in the habit of making just being proactive, and that's why I advocate a lot for folks being educated around asthma self-management, because it's you, the person that has the asthma. It's not the medical team. It's we want to help you, but the person that has asthma or who has the child with asthma, they have to live with that every day,
Mm.
all day, every day. So they should be invested, engaged in their own asthma self-management. So, and I say that as someone who has asthma myself. So I also follow that. So I try to make sure I have my medications on with me. And there are times I have a visit with my PCP and I'm like, I gotta do stuff for my kid first. So oftentimes, especially as a mom, you backburn your own kid. And that's another thing. Black women have one of the highest numbers of within the asthma disparities, of asthma related suffering and deaths. And so,
Wow.
yeah. And it makes sense to me because um I deal with that in real time because oftentimes we backburn our own care to take care of others. And you have to take care of yourself. And you know that as a burnout coach,
Mhm.
um, sometimes folks they just don't self-care is it's not something that's on the forefront, and it should be.
I think where I like was misled when I was in school is you're there for the patient, so you're kind of like um, deleting yourself. It's like you forget what.
Sacrificial lamb. Mm-hmm.
Yeah, it's like you like once you walk through the hospital doors, you forget everything that's going on at your house, and you focus on the patient. But it's like when you take your experiences like from the child that happened in your case, and I've had patient deaths as well, so
Mm-hmm.
I take my experience with me, and it just gives
Mm-hmm.
me a little bit more empathy to take care of that living patient, and it
Mm-hmm.
just gives me like that extra tender care. And I don't think health hospitals are trained on that subject area. They focus on the patient. The patient is the
Right.
customer, and the customer is always right, but they don't focus on the healthcare workers and if they're taking care of themselves.
Themselves. And I just let me add on to that because I had a discussion with that. I think something in school, like now we have folks like you who's addressing like burnout and how to deal with stuff like that. And because that was a miss in school for me too. They never really taught you how to deal with death. Hello. I
Mm,
feel like we deal with I worked at a level 1 trauma center. Like I was seeing people die left and right, and I didn't have time to. You just had to keep it moving. It's like, okay, well, I
mhm,
got got to take in the next patient or whatever. And what I didn't realize is that naturally, even before school, I never dealt with dealt with death. Um, like I just didn't know how to deal with it. You know what I'm saying? So now that I was seeing it so often, back in the day when I first started, I was starting to disconnect from people because it's like
mm.
it was starting. I didn't know it was affecting me, but it was. It was. And I think ultimately, I wish that was something school trained or, helped us to process, like how to deal with just deal with death in general, how to process that and be able to
Yeah,
continue your work.
yeah, because most people like when they before COVID, like funerals were just like once in the blue moon. But when we see death in the hospital, it's like it could be two or three times
Yeah.
in a
Oh my
day.
gosh.
Especially with COVID, it could be like more than that. Like
It's
the
crazy.
morgue was just filling up, and COVID was like a traumatizing in
Yes.
itself.
Yeah.
And to deal with that, like I don't think it's like a deal with it and you're done with it. It's kind of like deal with it and let's walk together and nurture and heal the wounds, because I feel like when we put so much work into people and our patients, we forget about ourselves. Like we
Mm-hmm.
need to fill our own cups
Correct.
after we've done all we can to save this life and that life has passed on. We need to turn that inward to ourselves and save our lives.
Totally agree. I totally agree. So it's it's something that I'm actively working on. This is so yeah. It's
So
hard.
what do you do to fill your cup as a busy mom and a busy wife? What do you
Oh
do?
gosh. Sister Annmarie. It is a struggle. Um But I definitely, for 2024, I definitely told myself the self-care was a priority. I because I found myself often just getting exhausted, like fumes exhausted. And I've been sick in my lifetime twice where I had to like take a time out for months. Like, okay, I couldn't do any, I couldn't, I had to have surgery. I made myself real sick because I ignored what was going on with my body. And once again, I just backburned my self care. So I every year try to remind myself to Linda, you have to take care of yourself. You have to unplug at times, and you do have to give yourself segments of just uh, to decompress. Yeah, decompress and just have some. I call it timeout segments. Like I okay, Linda, you need a timeout. And so I'm fortunate enough to have a good support system that I have created around me of friends and family, and they do understand. Like, okay, you know what, Linda is. I am a giver. I am a giver, and I live to serve. So I'm a go hard. It's how I show love and affection. Is I show love through acts of service. So I'm constantly on my feet. I'm gonna be there for you. I'm blah blah blah. But now I have I have the strength to say I need I need a timeout. Like
Yeah.
I just need a few minutes to myself, unplug, and then get that energy back up, and then I could get back on that. So
Yeah, I kind of thought of an idea. I don't know. I'll throw it out there. What if there was like an accountability community of other healthcare workers so that we could like actually have people who know what we're going through actually guide us through self care. Like, do you think that would be a good idea?
yeah, it sounds great. I think it's needed. I mean, all those. It sounds great. Yeah, because like you said, it's easy to be like, ah, I'll be fine, and
Mhm,
just keep going and going. And someone like me, I work finger to the bone. Like I said, like I've made myself
mhm,
sick, and
mhm.
so yeah, so I think it's a great idea. Come up with a community
Okay.
like that.
Okay.
Hmm.
Well, I'll put that on the back burner.
That's right.
So I
Yeah.
see for people who are listening, I see you have your background. You have a turtle and you have look like an inhaler and some lungs. Like, can you
Yes.
explain your
Oh yeah.
icon?
Yes. Okay. So the turtle. So yeah. So the turtle is what I love about turtles is what they symbolize. So to symbolize wisdom, longevity, perseverance. And even though when people see turtles, they think of something slow, the turtle always, no matter its pace, it's always progressing towards its destination. That's it. It's just like,
Mm,
I got to get somewhere, and I'm going to get there regardless. Even if this rock is in my way and I have to navigate away from the rock, it might take me longer, but I'm going to do it. And to
mm,
me, that's why I like the turtle. And the turtle also represents myself. I am an introvert. So I'm usually in my shell, but I have extrovert moments. So when
mm,
something important where I have there's somebody that doesn't have a voice, or to advocate for others, that's when I pop out of my shell to speak out for those without a voice, or for those that don't know their rights. Or so that's really what the turtle what it means. It gives just everything we've talked about. It gives me the courage, and I hope other people that are in their shell, the courage to speak about things that can change the narratives around, once again,
Mm.
things like Black health and um just health outcomes, just living the best quality of life. So that's what that all means. So
Oh, okay.
the lung, the lung, the stethoscope, the turtle, the inhaler, it's all everything around the asthma lady, um and my business, Nose Health ED LLC. So
So you have an education business for asthma, is that correct?
yeah, so I have a it's a healthcare consultancy business. So where
Oh,
help out other organizations. It could be nonprofits, other institutions. It could be another hospital, as far as starting their own program, health education program, asthma education program, or it could be another chronic disease like COPD or anything like that. Because to start any of those type of programs, um it's best to there's like a certain process to make it happen
hmm.
smoother, to get the ball rolling.
Okay.
So yeah, so that's what I help folks do, and especially around asthma, because that's my thing, that's my bread and butter. So hmm
Oh, okay.
yeah, so
So do you work?
I'm sorry, go ahead.
No, go ahead.
No, no, no. So yeah, I was gonna say. So I like when that's why I have this like this, because I know people are like, why is there a turtle there? It's meant. They're like, okay, I get the inhaler, I get
Yeah.
the lung, and I see the stuff. I don't understand the turtle, and the turtle is it's meant to engage and to have that conversation. So yeah,
Have a conversation. Oh, that's a conversation starter.
yeah.
And when I was in Hawaii, the turtles,
Ooh, Hawaii.
they are just, they were like really huge. And I know turtles live for a
Do
very,
you
very, very
understand
long
the
time.
longevity?
They
Yes.
live for a very
Yes.
long time. And you think that they're just so like docile, and
Mm-hmm.
but they have
That's
their
it.
own little ways.
That's it. And I
And like
love
the
it.
tortoise and the hare, like you go at a steady pace. And I think that's when you said a few minutes ago about being comfortable with being uncomfortable,
Mm-hmm.
and doing like a little weight and building up that muscle, because I think our world is the way it is right now because there are a lot of people who are comfortable being comfortable. So
Right. Right. I mean,
so
it's true. It's true. And people are scared to ask, um, to just not assume. How about we talk to one another and ask
Mhm,
appropriate questions, and instead of just assuming, well, maybe this person can't do this or whatever. We are in a weird time because, yeah, like you said,
mhm,
everybody's just comfortable being in their own bubble, and it's like, if you just listen, really listen on what's going on, you'll yeah, you'll get it. You'll be able to get it. And so yeah, empathy and meeting people where they are in life is what I'm about. I'm not really about talking at people and telling them what to do. It's like, I want you to have the information, have access to it, and then you make the best
mhm.
decision for yourself,
Yeah,
what's going to work for you at that given time. So yeah, and
yeah.
so it doesn't matter if you're a turtle. You know what I'm saying? If it's slow, if it's, as long as it's at your pace.
So,
Yeah, because shoot, I'm slow too. It took me time to get where I'm at, you know what I'm saying, to be this person.
mhm.
And just like the turtle, I'm still getting to my destination as far as health and just where I want to be in life. So yeah. Mhm.
And I see that you also have a new book guide coming out, Fixing
Yes.
Breathtaking Homes. Can you talk about that?
Yes. Okay. So fixing breathtaking homes. Okay. So I have a guide to removing asthma triggers. There you go. A guide for removing asthma
Okay.
triggers from the home environment. So basically, easy read. It's 74 pages, and it is a guide, once again, about removing those triggers from the home. So it and it's doing it in a way where I'm not just telling you to go buy stuff. Like, okay, go buy this expensive vacuum or this air purifier. I'm actually telling you like, hey, you can DIY it. You can make your own air purifier. And the resources
Oh,
are over here. And you don't have to buy some fancy dust buster, to clean your blinds. You can do it with
hmm.
a pair of used socks and some olive oil
Oh,
or baby
okay.
oil. So I'm just giving like practical tips on what someone can do that has asthma or that has children with asthma or take care of someone with asthma. Because, like we were talking about, you cannot change the weather, pollen, any of these things. But what you can do is you can start to remove those triggers from the home because the home,
Hmm,
most of us do have some control, some type of control of what's going on in
hmm,
our home. So that is the best place to start is the home environment. So that's pretty much what the book is about. So once again, I am a content creator around asthma. So I don't care what the vehicle is. It could be a podcast, it could be a book, it could be a post, a newsletter, whatever. As long as people are getting the information, it's all good. That's it. So yes. So I'm excited about just providing the information in a way that is digestible to all.
yeah.
Yeah,
Yeah, because there's so much information out there, but everyone learns differently. So you need
correct.
different mediums so that
Yeah,
they can actually retain the information and
correct.
take action.
Oh, that not even retain. How about just even just look at it and be like, huh? Like, well, that looks interesting because how many distractions, how many things are out here trying to get your attention, especially in the day of social media. You understand edutainment. Come on.
Mhm.
It's now because of these attention spans, and we now have to put information in a way that it's like engaging to at least get the person to be like, let me see what this is about, just to get
Mhm.
them to look, forget retain.
Yeah, we just need to look.
Just to
Look
be
at it.
curious, like let me take a crack at this thing real quick right here, it's,
Yeah, it's just like when you said you saw that sign
you
about being an
understand.
RT, like
Yeah,
you it said like, do you like to help people?
right,
Do you know about respiratory therapy? So it kind of like the
correct.
sign like caught your attention.
So yeah, that's what yeah, these are the times we in. So yeah. Yep. Doesn't matter to me what vehicle. I don't care. I'll do a party and sprinkle some asthma education in it. I don't care. I've done it all. Done I've done Zumba parties. I've done
Oh
a
wow.
vision board events, and sprinkle some asthma education. I've done sex education and sprinkled in asthma education right after. It's insane. It doesn't matter.
Wow.
Yep.
And you also have a podcast, RT's Share
Yes,
Tea.
yes. So RT Share Tea podcast, similar. Once again, just another vehicle of spreading asthma awareness and also the RT profession. So I also do speak about just life as a respiratory therapist, work life balance, and career management in the healthcare space. So just knowing how to navigate through the career, giving career advice, and that type of stuff. So that's what RT Share T is about. So you're gonna get a little asthma, a little career advice, a little professional development advice, and just maybe a little chuckle here and there. Look, that's
You
that's
know,
why I too
I actually
fancy.
I took an improv class,
Oh,
and
okay.
I did stand up for the first time
Oh,
last in January.
so how did you
So
like it? Was it
I did.
was you
I
scared?
liked.
Like, how did that?
I was definitely scared.
Yo,
I was definitely
I'd be scared.
uncomfortable.
That is a good one. Ooh, improv on stage. Ooh, let me tell you, that would test my deodorant. My deodorant would be. Ooh. That would be a true testimony that the deodorant works or not, because that's a well, congratulations. I'm happy
Thank you.
for you, because yeah, I don't know if I could do that one.
So, to close out, do you have any advice for healthcare workers who are, um, they have a side passion and they're just getting started, like, and they're uncomfortable? Like, how do they overcome that fear, or any other thing
Mm.
you have to add?
Um, Basically, what we were talking about is just going for it, doing it. Um, what I say is, if you're gonna talk the talk, walk the walk. This is what it is. It's like that. Don't just talk about it. Put it in action in real time, and just and little by little. It doesn't have to be jumping full in. Just little by little. Turtle, right? Turtle, right?
Turtle, turtle.
Because that's when you're gonna know if you like something or not. It's
Mm,
just you have to do it. People like to
mm,
talk a lot, and it's like, they plan, and planning is good. I am a planner. Planner is really good, but eventually, you have to do. You have to do it.
you have to do.
You have to do.
Just do it.
Just do it. There's a reason why that slogan been around for all that time and made all that money. Just do it. And sometimes you have to understand how some people just can't do it. It's like they
Really?
want to do it, but they can't. Annmarie, how many you know how
Ah,
many people ask me, tell me, they be like, Linda, I want to start my own podcast. How do I? And I'll be like, listen, just like you. I'm like, just do it. Just do it. And what did you do? You did it.
I did it.
That's why I was like, you know what? I can mess with Annmarie, because said she said it and she did it, and that's all it is. That's all it is.
Oh,
And what you do is, and I appreciate you, Annmarie. I appreciate. Thank you for being a guest co-host on my show, RT Shanty. By the way,
you're
you did a great
welcome.
job. Um,
Thank you.
and yeah, that's why I mess with folks like you, because you said you were going to do something and you followed through. You did it, and you doing it in your way, your own capacity, and you're not you're being yourself, and that's it. That's all you need, is just to be your authentic self, and whatever you say you're going to do, you do it, and you tailor as you go along. That's it.
Mhm.
That's it.
Yeah, and I think what I don't know, maybe for you, but for me, when I say I'm gonna do something, I tell people I'm gonna do it, so they could be like, "You told me you were gonna do this.
Right.
Are you doing
That
it?"
accountability, right?
Ability, yeah.
Yeah, 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 yeah. I am the person, when I say I'm gonna do something, I'm shaking and press the send button. All right, send. Okay, we did it. We did it.
So,
We
we
did
did
it.
it. We
I
did
did it.
it.
I published the book. I started the podcast. Whatever it is, press send. All right, it is what it is.
So what's next? What's next?
Oh
What
my
do you
gosh.
have next?
So Asthma Awareness Month is coming. So very busy month, the month of May. And so I'm going to be with the asthma and allergy, I'm sorry, I'm going to be with the Allergy and Asthma Network in Washington, DC, and on May 8th. So we're going to be advocating. So that is their advocacy day on Capitol Hill. So we're going to be doing that. And I have a whole bunch. I can't even remember everything off the top of my head. Going on in May for Asthma Awareness Month. So just look out for that stuff. And yeah, just doing. I'm trying to think of anything else. Like I said, I got the book, so just going to be giving away some of the book to people of need. So just stuff like that. So when I create, I'm not really looking for money per se. I'm looking more to just
Okay.
get it in the hands of the people that need
Yes.
it. So that's really, so I'm really excited about continuing to create content and just to keep doing this type of work. More the 100th episode of RT Share Tea is coming out soon.
Oh, wow.
Woo!
Congratulations.
Yes, thank you. Boo. Annmarie, trust me. I did not think I could make it to 100 episodes, but I'm excited about that.
Wow.
So yeah, so just God willing, just a lot of stuff coming. So I'm excited. I'm excited.
Awesome. Well,
So
I'm
thank
so
you.
excited. Thank you so much, Linda, the asthma lady, for
Thank you.
coming on Scrubs Unzipped.
Thank
And
you.
I'm going to end it, but I want you to stay on so